I would like to welcome everyone to today's What We Heard webinar from Early Engagement Processes for Building the Oxford Homelessness and Addiction Recovery Treatment, or HART Hub. Today, we will be sharing what we learned as we heard from the community as they provided input on the HART Hub. We're reporting back to emphasize transparency and collaboration. Throughout this process, I heard a lot from people, the quote, meeting people where they are at, but I'm sorry, I'm starting over. I'm gonna focus and I'll start over.
Okay, that's okay. Don't worry about that at all.
I stopped looking at the script and I'm like, why did I do that?
No,
I'm
it's a
gonna look at
Friday
the script.
afternoon. It's a Friday afternoon. It's totally okay.
Okay, starting over. I would like to welcome everyone to today's What We Heard webinar from Early Engagement Processes for Building the Oxford Homelessness and Addiction Recovery Treatment, or HART Hub. Today, we will be sharing what we learned as we heard from the community as they provided input on the HART Hub. We are reporting back to emphasize transparency and collaboration. I want to start by highlighting a quote we heard: meeting people where they are at by listening and building solutions together, which really reflects the core principles of the engagement process. Today, we're welcoming everyone to the call, doing a land acknowledgement and providing support with technology, providing a brief overview of what the HART Hub is, although the details are not in scope for today's webinar, and we'll really focus on the engagement processes we have taken on. We'll spend most of our time sharing what we heard, the key themes and quotes, then identify the key recommendations and next steps. Before we get started, I want to provide a land acknowledgement. Let us take some time to recognize the importance of this land where we live and work. The Oxford OHT recognizes the traditional territories of the nations of the Haudenosaunee, Mississauga, Ottawandarok, and Anishinaabeg peoples, and the treaty relationships, particularly Treaty 3 and Treaty 29, connected to Oxford County. With the intention of learning and unlearning, we are reaffirming our commitment to and responsibility toward Indigenous peoples and their diverse, all-encompassing cultures. It is important to think about the past wrongs and mistakes, to acknowledge them, and to consider how we, as a group and as individuals, might continue to work toward justice, unlearning, and reconciliation. I will add that truth and reconciliation is a part of my role in a lot of the work that we do with the OHT, and it's also been heavily involved in building the HART Hub. And while I won't be touching on those processes in this webinar, I hope that we'll be able to do so in the future. Before we get too much further into this, I'm going to take a moment to introduce myself. I'm Emily Porchak, the Community Engagement Project Coordinator for the Oxford, Ontario Health Team. In my role, I support the community in having their voices heard and incorporated into projects within the Oxford OHT. I led the early phases of the HART Hub work with the support of lots of colleagues. And now I'm going to pass it over to Malaysia to introduce herself.
Thank you, Emily. So my name is Malaysia Sandhu, and I currently work at Southwestern Public Health as a health promoter working in health equity. Alongside Emily, I helped develop the materials and co-facilitated the HART Hub co-design sessions.
We did not record the live sessions, but right now we are filming a recorded session, and we went through technology supports with the participants during live sessions. I'm just going to jump right into what the HART Hub is. What the HART Hub is really about understanding that people across Oxford County are facing challenges from every walks of life. This includes our neighbors, friends, coworkers, and family members, and many go without care until a crisis occurs. For years, many people needing treatment, recovery, or support had to travel outside of our community, often far from their families, support networks, and sense of home. This created barriers at the very moment when help was needed most. The Oxford Heart Hub is a community-driven solution to make a change. We understand that there's not a single program that can solve everything overnight, but experience tells us that coordinated, compassionate care built with the community helps people stabilize, recover, and rebuild. The term Heart Hub is somewhat misleading as it is not just one site or location. The hub is a connected network that offers coordinated care, shared information, warm connections between services, and the right help at the right time. Whether someone reaches out by phone, through a partner agency, through outreach, or at a wellness center, they should have a no wrong door experience. This means that regardless of how or where a client accesses the system, they will be embraced with care, respect, and commitment to their well-being close to home. And this work is truly built on collaboration. The Woodstock Hospital and community partners collaborating through the Oxford OHT are collaborating across health, housing, and social services domains. This slide lists just some of the many people and organizations involved, including community organizations, frontline staff, and people with lived experience. The growing list of 16 plus partners involved in this project can be found on the Heart Hub Initiatives page and in the full report. Now we get into why we're really doing this session. So, how did we engage with the community to inform this work? Well, we knew from the beginning that a single engagement method would not be enough to truly capture the diversity of experiences across Oxford County. So far, we have used three approaches. First, we hosted Harwood Community Conversations, which allowed us to hear deeply rooted community stories and values. Second, we conducted a co-design roadshow using journey mapping and prioritization exercises to understand real experiences navigating services. And third, we completed surveys with people living in encampments, ensuring we included voices that often face the greatest barriers to participation. Together, these approaches helped us move beyond assumptions and center lived and living experience throughout the process. To guide this outreach, we developed a population matrix. So this is a tool to help us be intentional about who we hoped to reach, especially populations that are often underrepresented in traditional engagement. This included people with lived experience of homelessness, people who use substances, Indigenous community members, youth, women, and many more. The matrix helped us identify gaps in representation early and adjust our outreach strategies accordingly, rather than realizing those gaps after engagement was complete. We hosted 4 Harwood community conversation sessions in partnership with United Way Oxford. With a total of 29 participants, these conversations were like focus groups where small groups shared honest thoughts on what an ideal Heart Hub would look like in Oxford. From these conversations, 9 community stories were developed, and these stories capture shared experiences, challenges, hopes related to homelessness, addiction, and recovery in Oxford County. Rather than focusing on solutions right away, these conversations allowed us to listen to what truly matters to people, what they care about most, and where trust has been built or broken within systems. The Co-Design Roadshow included 7 sessions throughout Oxford County with 80 participants. A core principle of this work was meeting people where they are, so we hosted sessions in familiar spaces to those that we were hoping to reach, such as at Operation Sharing and Indwell. We also offered meals, honorariums, accessible locations, and flexible participant accommodations. These sessions brought together people with lived and living experience, frontline workers, and caregivers to map real journeys through services, identify pain points, and prioritize what matters most. This approach helped shift the dynamic from consultation towards collaboration. I'm going to hand it over to Malaysia for the next section.
Thank you so much, Emily. So, as Emily previously mentioned, in addition to our in person engagement, we completed 11 encampment outreach surveys, and these were conducted alongside Community, the Oxford County Community Health Center mobile health outreach bus, largely due to the support from Amanda Cook. This really allowed us to connect with individuals who were not able or comfortable attending formal sessions. And this step was really critical to ensuring we included people experiencing the most acute barriers to care and engagement. And so, across the 7 co design sessions held throughout Oxford County, participants shared powerful and honest insights about what is needed to build an inclusive heart hub. And these were some of the main themes from the sessions. And in the following slides, I'll break down each theme into more detail. So, the most frequently mentioned theme was emotional safety with 164 mentions, and this was closely followed by system navigation and service coordination and staffing, including peer support. And these themes consistently surface across all participant groups, really highlighting shared experiences regardless of role or background. And in total, over 1,000 ideas were collected through sticky notes, group discussions, and journey mapping exercises. Every sticky note was transcribed and a structured theme based analysis was completed. And to help visualize what came up most often, we created a word cloud from the mapping sticky notes. The most common mentions were support, appearing 137 times, followed by services, housing, and access. And these words really reinforce what we heard throughout the sessions, that people are seeking coordinated, compassionate, and accessible support that meets them where they are. Now, one message that came through clearly was that food and basic needs met first, only then can you think about recovery. So, participants emphasized that without basic needs like food, shelter, transportation, identification, phone access, and internet, it becomes nearly impossible to focus on recovery, employment, or healthcare. There was also a strong concern about the gap between current income supports and the actual cost of living, and many shared that Ontario Works and ODSP rates are not enough to cover rent or essentials. Now, housing was described as foundational. As one participant put it, you can't heal if you don't have a home. Approximately 28% of survey statements related directly to housing, and participants spoke about the need for sober living, transitional, and gender specific housing options that are safe and welcoming. Ongoing housing support after treatment was also emphasized, particularly the need for transitional housing that bridges the gap between treatment and full independence. Now, participants consistently highlighted the need for long term, consistent mental health and addiction supports rather than short term crisis only care. And as one person shared, there will always be fear of the unknown, but we need people who don't give up on us. So, mental health and substance use challenges were described as deeply interconnected, requiring trauma informed and coordinated approaches. And stigma and fear of judgment were major barriers, leading many to avoid seeking help altogether. So participants called for a broader education about addiction as a disease and not as a personal failure. System navigation was a major source of frustration, as many participants shared experiences of being passed from one agency to another and having to repeat their story multiple times. One participant described this as re traumatizing, and people called for centralized coordination where information can be safely shared and individuals have a single trusted contact who follows them over time. Now, staffing emerged as a critical factor in recovery. As one participant said, peer support saved my life. They understand because they've been there. Participants emphasized the importance of compassion, consistent, and well trained staff, including people with lived experience. They also highlighted the need to support staff themselves, recognizing that burnout and turnover disrupt continuity of care. Now, emotional safety was one of the most prominent themes across all sessions. Participants spoke about fear, shame, and judgment as ongoing barriers. Some described feeling institutionalized by systems that lack empathy, Creating emotionally safe environments allow people to be honest about their struggles and stay engaged in their care. Now, families and communities were recognized as essential partners in recovery, and participants emphasized the need for family inclusive supports, education, and peer groups, noting that caregivers also need healing and guidance. And community based supports were seen as critical for reducing isolation and building meaningful connections. Education and skills development were described as powerful tools for long term stability. One participant shared, "Help me get my GED, that would change everything." Participants highlighted barriers related to learning disabilities, access to education, and job training. There was strong interest in programs that support literacy, employment readiness, confidence building, and living independently. And finally, participants spoke deeply about cultural safety and equity. As one person shared, not having cultural connection is a barrier, it's part of healing. Participants called for more Indigenous led programming, faith based supports, and culturally representative staff and services. And there was also a strong emphasis on reducing stigma and designing services that are inclusive of language, gender, identity, and lived experience. And now I'm going to hand it back to Emily to talk about the community informed recommendations.
Thank you, Malaysia. Based on those key themes, I'm going to discuss the recommendations that were developed from those community identified needs for consideration in the Heart Hub. I want to be really transparent that these are opportunities for action, not commitments. So, first, around that theme of supporting basic needs, we will explore consistent access to food, shelter, hygiene, and crisis services, as well as access to phones and internet. We'll be working to see if there's ways to increase access to shower and laundry facilities, as well as drop-in spaces. And from a systems level, explore partnerships to expand digital access, advocate for increased financial supports, and year-round shelter access throughout Oxford. The second area is housing, and that's looking at how to create pathways to affordable, stable, and supportive housing while reducing administrative barriers related to identification, documentation, and phone access. The next area is around mental health and addiction supports, providing free or low cost counseling and addiction services closer to where people live, exploring how we can offer group-based programming, peer-led supports, and community connection activities, as well as ongoing support post-discharge to really support that longer-term recovery. For the system navigation and coordination theme, it's really emphasizing that need for the no wrong door approach to make sure that there's no wrong place to ask for help so that it's really clear for community members and staff how to access the care that's needed so staff can support those that are reaching out. We also will be exploring one place for intake and consent, and if it's possible to have information sharing among trusted staff across organizations that are working with the same person. For the compassionate and skilled supported workforce, that's really looking at how we can make sure there's consistent staff and less turnover from instead of having kind of a different person constantly coming in, is there any way to kind of have each staff focus on less people so it can be more consistent? Looking at how we can include those peer support roles to really highlight that lived experience, providing ongoing trauma-informed harm reduction and empathy-based training so that it's not just a one-off, and supporting that staff wellness and burnout. This is a theme that came up across many of our co-design roadshow locations. People were really concerned about staff well-being, so exploring what we can do to support the staff as well. Around creating safe and welcoming spaces, it's thinking about how we can adapt any spaces that we're using to feel more human and community centered rather than institutional. prioritizing relationship-based and conversational approaches, and continuing to co-design service standards with people with lived and living experience to really help define what safe and welcoming means. And our last slide of recommendations includes family and community connection. So, really exploring those anti stigma campaigns so people understand homelessness, substance use, mental health challenges, and recovery, and increasing the awareness of the services that are available and how to access them. We'll also explore family reconnection resources where it's safe and desired, and education and support groups for caregivers or family members. We will look at our skill building and meaningful participation. So, how can we add in life skills, education, job readiness, employment supports into that recovery process and support that integration back into community for those who want and need this through volunteer and community participation opportunities. But that kind of leads with the question of, okay, but what's next? And that's where I want to be really clear that community engagement for the Oxford Heart Hub does not end here. We're still actively working on embedding as many of these recommendations as possible into the Heart Hub, and we're going to report back on our progress. It may not be possible or appropriate to implement all of these recommendations right now within the Heart Hub funding scope and limitations. But we will use these recommendations to inform ongoing planning and decision making while working with partners to determine what practical and meaningful next steps we can take. We also include community members and working groups and as part of the core partnership team guiding the project. And as we continue on this journey, we expect that there will be more opportunities to learn about the Heart Hub and provide input and feedback. We will be working hard to amplify awareness for the Heart Hub in the coming months. So, on that note, you can stay connected by signing up for updates about the Heart Hub through our newsletter or visiting the Heart Hub website. And you can read the full report on what we heard online. And since this is the recorded version, there's not an opportunity for us to answer your questions, but I am going to bring up a question that someone asked, and they said, is the Heart Hub live and operational? And I do want to confirm that central intake for the Oxford Heart Hub is now available 24/7. This means that individuals over the age of 18 that are looking for mental health and addiction support can self-refer anytime by calling 519-537-2382, and a member of the team will support you with your needs and get you connected to the right care pathway. Also, on December 1st, the temporary site on Huron Street officially began bed-based care, which is a voluntary treatment and recovery facility. So super exciting that we have started with the operations of the Heart Hub. And finally, thank you so much for taking the time to watch this recording. Just one more plug to say that the Heart Hub webpage and newsletter will be the best places to stay up to date as this project continues to evolve.